talk, as they all have been today. I think it's been a really useful evening. I wanted to add a couple of points. The first area that hasn't come up a lot today, but it is sort of affected by all of the services that we've described, and that's the physical health of people with mental health problems, and indeed people with learning disabilities and autism as well, and their access to physical health care. And we've still got a long way to go on that in Berkshire, but I think we also have made quite a lot of progress. And actually the merger of community health services has been helpful in that area. And one example of improved physical health care, it has been a priority in our quality accounts, but one example has been the input of West Call to Prospect Park Hospital in terms of GP support for mental health patients, and up until very recently we had some very long-term mental health patients in Prospect Park who subsequently have now moved out into a community placement. But our input from West Call, I really think, improved the care of those patients. And I did want to mention today Graham Busfield, who was one of the West Call GPs who provided that service, and sadly he died in June this year. But I did want to remember him today because he made a real difference to those patients. I wanted to reiterate some of the points that Michael's made. I, during my training, had some really good experience actually of psychological medicine, liaison psychiatry at John Radcliffe under Professor Mayo, also at Guy's under I've forgotten his name, Jim Watson, which was great, and Malcolm Hawthorne in Frimley Park. So it's a really good experience. I'm really pleased that through Luke and Abra we've also been able to provide a training post in the deanery in Berkshire, and I think that's really important. And I'm very pleased that that's in place, and we can build from that in terms of training doctors. When I came to Berkshire, I was a little bit disappointed with the level of psychological medicine that we had in Berkshire. We had some health psychology that was generally developed through the Royal Berks, and we had some A&E services that were nurse-led. But I think it's been a real success, as again a way to go, but a real success over recent years in the development of those services and the better integration of those services. And I particularly clearly like to thank Luke at this point for the work that he's done in developing those services, and indeed the work that he's done today in making this evening possible. So I would just like to thank Luke. And of course the team that have been working with him. I will mention the Academic Health Science Network. I'm very grateful to the Academic Health Science Network for supporting today. I think clearly it is now licensed in Oxford, and we are developing, haven't got quite as much resource as we initially expected, so we're developing the areas to focus on, and that physical mental health interface is one of the areas that we're looking at within mental health side. But I think it will be important, whatever happens, in terms of that integration in all of the clinical networks within the Academic Health Science Network. And I think it is a real opportunity with both the Academic Health Science Network, the Strategic Clinical Network, and the Collaboration for Leadership in Applied Health Research. There's a real opportunity to get these networks working well between researchers, clinicians, with health science industry, life science industry, and involving patients and carers in working together to, okay, we need to identify best practice and implement that across the region and beyond. But you also have the opportunity for, given the advances in basic sciences, neuroscience, in computers, in imaging, in the potential for pharmaceutical developments and other areas such as stem cell research, there really is the opportunity for something quite transformational to happen, I think, within mental health treatment. As Michael described, there hasn't, in many ways, there hasn't been great advances with a transformational treatment approach, or indeed a prevention approach or identification of illness that really made a massive difference. It's been fairly incremental, and the psychological therapies clearly have developed over time and been much more evidence-based. But during my time as a psychiatrist, you haven't really had that very great breakthrough. And I actually am very optimistic through the other developments that have been occurring that this might be a very special time to be involved in psychiatry and in mental health. So I'm very, very grateful for all our speakers, and I'm very grateful to all of you for coming and giving up your evening, and I think it's been a very worthwhile evening. So thank you very much indeed.